The Kaiser Permanente Santa Clara Emergency Department is a wonderful program. It's an interface with the community like nowhere else you get in the Bay Area. It's a very diverse community, and it's just a wonderful place of kind humans and kind providers.
I think it's an excellent place to learn as a resident here at Kaiser Permanente in Santa Clara. In addition to the academic center that is Stanford, here it's a very strong community center. We have a lot of pathology, we have an increasingly high volume, and I think you just learn a very different way of making things work.
The top 5 resident experiences at Kaiser Santa Clara are excellent one-on-one experience with attendings, incredible accessibility of consultants, fabulous ultrasound, really kind of top-notch care, and fabulous nursing staff and facilities.
We are a STEMI or ST elevation MI receiving center where we see patients with acute heart attacks having ST elevation MIs. We are a thrombectomy capable stroke center. We have a large pediatric population. We are a comprehensive pediatric receiving center for the county.
Kaiser Santa Clara won America's 50 Best Hospitals partly because of the incredible specialized care it offers patients, and then also because patient satisfaction is really good.
Hi, I'm Rio Beardsley, a second-year resident at Stanford as an emergency medicine resident here in Santa Clara. This is our wonderful ambulance bay. Behind me are our decontamination showers, and the rest of the emergency room is right through here. This is the entrance to our ambulance bay. This is where we do our stroke code on these beds with those telemedicine computers to contact our on-call neurologist. The sickest patients generally stop here. We triage and then send them to the rest of the emergency room.
We have 24/7 stroke teleneurology, which is incredible when you have patients presenting at 3 in the morning with left-sided deficits and you have to decide whether or not to give them TPA.
This is one of our code rooms right here. In here, we will resuscitate our sickest patients. As an emergency resident, you might find yourself at the head of the bed managing the airway, or later on in residency at the foot of the bed running the code.
We have an LVAD-capable facility, which means that patients whose hearts are not working are getting left ventricular assist devices, and you have 24/7 consultant ability in order to help manage those patients as well.
We found the heart.
In the emergency room, there are probably 10 ultrasound machines, so there is one whenever I need one, I can always find one.
Behind me, we have our rapid care area for our lower acuity patients. To my left is where the code rooms are, our sickest patients down those hallways, and these two right here is to the main section of our emergency room. It's a 46-bed ER with the capacity to flex to 90, so you'll see a lot of patients with a lot of different diseases here at Kaiser.
We have an outstanding group of attending faculty physicians, about 60 physicians. Many of them have completed fellowships in specific areas such as toxicology or ultrasound.
This is our procedure area. Behind me to my left, we have our ENT cart. To our right, we have our laceration repair cart. Right here, you can see some of our ophthalmology supplies like our slit lamps. You'll have access to all of these and much more here in the Kaiser Emergency Room. This is the hub of our emergency room. Behind us, you can see our charge nurse and our unit coordinator and the rest of the beds down this hallway and there.
One of the highlights of this residency program is really training at an academic center, a county center, and then here at Kaiser Santa Clara, we provide the residents a community experience. It's a high degree of learning for our residents, both in the types of clinical cases that they see, but also in the types of faculty they interact with.
This is our green zone patient care area. Here we see our more stable patients, classically abdominal pain, chest pain, psychiatric complaints, those diseases that are able to be cared for in a more quiet, stable part of the emergency room. This is one of our 4 main supply rooms here at Kaiser. Here you'll see the access you have to the supplies and tools you'll need to take care of the patients here. You have ample access to everything you can think of that you'll need to provide the awesome care here at Kaiser.
Our residents are incredible. I would describe our residents as just full-on good eggs. You know, they work incredibly hard. They have great senses of humor. They are visionaries. They have ideas. They act on those ideas.
It's a great place, not just the hospital, not just the attendings, the residents, the culture, but also the location. You can't really beat the Bay Area in terms of, year-round sunny weather. It's a really good program that's designed with the resident experience in mind.
When you're considering a residency program in emergency medicine, you want to consider also the different sites you'll be rotating at. The Kaiser Permanente Santa Clara Emergency Department provides exposure and work within an integrated healthcare system. where you're not only seeing and treating patients in the emergency department, but you're providing them with care after they leave the emergency department.
I think Kaiser Permanente is the future of medicine. And because of that, I think it's really important to do your training there. I can practice medicine without fear, knowing that my patients are going to get excellent outpatient follow-up if I decide to discharge them. Our in-house consultants are courteous and responsive, and our team feels like a family.
Behind these doors is the exit to our waiting room. Thank you so much for joining me on the tour of the ED at Kaiser Permanente Santa Clara. It is an incredible residency full of awesome people, and I truly hope to see you here.